When should prednisone not be used? What are prednisone contraindications? Hi, I'm Dr. Megan, the prednisone pharmacist, and prednisone is a miraculous medication, but it's also an incredibly potentially harmful medication if you're the wrong person. So let's talk about who should not use prednisone. So contraindication is a really big fancy medical word that basically means who should not use a drug, all right? It's basically when you know the harm of a medication vastly outweighs any benefit. It's truly the benefit and risk calculation to the extreme. So a contraindication is there is so little benefit and so dramatically amount of high risk that do not use this drug. As we go throughout the video, we'll talk about others where it's more gray, where the balance is harder to decipher and you'd have to work with your doctor to find out. So definitely talk to your doctor before stopping this medication or any other medication. But these are some principles that you can use to decide whether prednisone is right for you. Prednisone is amazing because it suppresses the immune system to turn off autoimmune overreactions like in lupus, arthritis, and other inflammatory conditions. It saved my life and many other people, but it comes at a cost, and those are many side effects. And so some of the side effects are part of where the contraindications come from, but there are only a few absolute contraindications where you should never, ever, ever use prednisone. And the main one is really if you're allergic to prednisone. If you're allergic to prednisone, don't take it. It's pretty simple. Even though it's often used to help with allergies, do not take prednisone if you're allergic to it. And then this is where the balance starts tilting a little bit more gray. So in severe infections that are being untreated by other anti-infective medications, whether you're on an antibiotic, antifungal, if none of those are in place and you have a severe infection, the immunosuppressive effect of the prednisone may be too much for your immune system, and you may succumb to those infections. Being on prednisone increases your risk for pneumonia, sepsis, and other infections. So you want to make sure that those infections are being treated before taking prednisone. And then systemic fungal infections. That means a fungal infection in your whole body, not just like thrush in your mouth or like your toe has a fungal infection. Not that. It's like in your blood, in your whole body. Those are pretty dangerous situations, and you really need your immune system in place. So you'd want to definitely be working with your doctor to make sure it's appropriate for you. Now, this is where it's getting even more gray. There are some conditions for which doctors and often physician's assistants or nurse practitioners may prescribe prednisone where it's probably not actually appropriate, but it's not like a black and white do not use. It's more like it's probably not going to help. So why are you using it? And these are basically if a kid can bring home an infection from school, prednisone and other steroids are probably not going to help. There's a part of me that wants to go on a crusade that says, stop steroids for seasonal sicknesses. And let's start a steroid stewardship program to stop doctors from prescribing prednisone and other steroids for these seasonal sicknesses. There's really not much reason to take prednisone if you have the following: influenza, bronchitis, cough, cold, COVID, sinus infection, otitis media, ear infection, strep throat, community-acquired pneumonia. The risks outweigh any potential benefits, and in fact, prednisone may worsen some of these conditions. So if your doctor's prescribing it for any of those reasons, don't take it unless like there's an underlying reason, like for example, you have asthma or COPD. It's just not worth it for any of those seasonal sicknesses that a kid can bring home from school. Now we move on to relative contraindications. These are if your disease is so bad that prednisone giving you more or worsening that disease as a side effect is going to be a problem. That's what we're talking about. Prednisone can still be used, but with caution. So first, diabetes. Prednisone is probably used with diabetes a lot. But the problem is prednisone is increasing your blood sugar. So it's maybe worsening your blood sugar. So be sure to be careful checking your blood sugar, increasing your insulin dose if necessary, but be very watchful that you're keeping your diabetes under control while taking prednisone. Second is hypertension or high blood pressure. Prednisone can increase your blood pressure, so be sure to be checking your blood pressure, getting on the appropriate medication dosage of your antihypertensive medication. Third, osteoporosis. Prednisone is the number one drug that causes osteoporosis. So if you already have osteoporosis, this can worsen the bone loss and the risk for bone fractures and loss of height. So be sure you're doing whatever precautions necessary with your doctor, whether it's medication, injectable medication, calcium and vitamin D supplementation, to minimize potential complications from osteoporosis worsening. Fourth is peptic ulcers or GI bleeding. So prednisone can thin the gut lining, and especially when taken with another medication, which I'm going to get to in a minute, it can thin the gut lining, leading to like holes in the gut. And that can lead to bleeding or ulcers, and it's a problem. Next is mental health conditions. If you have severe anxiety, psychosis, mania pre-existing, prednisone can potentially worsen those. And so it should only be done being sure to weigh the balance of benefits and risks. Next, your eyes, glaucoma and cataracts. Prednisone can cause cataracts and worsen glaucoma. So be sure that you're getting checked with your eye doctor to make sure this is appropriate for you. Finally, heart failure. Prednisone can worsen heart disease in general and specifically heart failure. So here are some medications that may be a contraindication that you maybe possibly should avoid either while on prednisone, or if you're already taking them, maybe prednisone is not appropriate for you. First is ketoconazole. This takes us back to the severe fungal infections. This is an antifungal medication that can cause a drug interaction with prednisone, and so you do not want to do the combination of these two. Anticoagulants like warfarin or Coumadin, prednisone can increase your risk for bleeding because they're using a same pathway to be metabolized. All right, that medication I promised I would talk about peptic ulcers, and that is NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, meloxicam, Celebrex or celecoxib. These all are working in the same way as prednisone to thin your gut. It's a drug interaction, and so it can potentially lead to a fatal GI bleed. Like you can bleed to death because of this. So always be sure that if you have to take prednisone, that taking these medications is still absolutely necessary. And there are other ways that you can deal with that situation, but like you should avoid that combination if at all possible. Aspirin is related to that, similar situation. Anti-seizure drugs like phenobarbital or phenytoin also have a drug interaction, and rifampin. These all potentially have drug interactions that should be avoided. Either changing one of the medications or avoiding one of the medications is usually how these need to be dealt with. So what about special populations like pregnancy or breastfeeding? This is really between you and your doctor and your baby's doctor. Generally, if your situation, your health is bad enough to need prednisone while you're pregnant, having that condition untreated is worse for your baby than the possible side effects of prednisone for your baby. And so that's a really nuanced discussion you've got to have with your doctor. But for example, if your asthma is so bad, you're not breathing while you're pregnant, then you're having low oxygen going to your baby, and that can lead to brain damage. So you want to get your asthma under control. If prednisone is absolutely necessary, then it makes more sense to take the prednisone than to not take the prednisone. But that's a conversation you've got to have with your doctor. Prednisone can be excreted in the breast milk, and it can decrease milk supply. As possible thing happened to me. So if necessary, this is something you can do, but talk to your doctor about it. And then children. So prednisone is often used in children, and the benefits must outweigh the risks. But one of the risks is a potential loss of height. It can suppress growth, like vertical growth, and all the other complications I've already mentioned. So it should only be used when absolutely necessary and at the lowest effective dose. And then the elderly. So a lot of the side effects I mentioned are worse for older people. So along with everyone else, the lowest effective dose necessary for your condition. So what can you do? Well, definitely talk to your doctor. Be in close communication. Make sure that they're aware of these contraindications if you have them and they don't know about them. And see if there are any other medications they can give you instead, or to minimize the side effects. And then your doctor can closely monitor you, whether it's checking your eyes or checking your blood pressure or checking your blood sugar. All of those things are things that can be checked and monitored and to keep you safe and healthy if you must take prednisone, like I did. There is a really simple list I came up with. It's called the Prednisone Checklist of all of the things that your doctor can be checking, that you can be doing to make sure that you're keeping yourself safe as possible while on prednisone. It's free. All you do is click the link below to download it now. It's called the Prednisone Checklist, and it will help you minimize your side effects so that you can feel as well as possible on prednisone to minimize these contraindications if they are relevant for you. Signing off is Dr. Megan, your prednisone pharmacist.